We are here with Tom Priselac, President and CEO of the Cedars-Sinai Health System in California, to talk about some of the changes we're seeing occur within our healthcare landscape. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly, Senior Writer for AHA. In this podcast, we'll discuss how these new healthcare trends are driving the increase in hospitals and health systems that are merging and entering new relationships. Tom will also attempt to debunk some of the misinformation currently in the public narrative and speak to how the goal of consolidation is to enhance high-quality care for patients through lowering costs, improving quality, and expanding access. Tom, share your thoughts on why hospitals and health systems are undergoing significant change.
So I think hospitals and health systems around the country are really pursuing more and more integration with each other, largely because they're committed to trying to answer the questions of affordability and accessibility. Everyone recognizes that the affordability question is number one in the public's mind. And if you really understand the underlying economics of hospitals and hospital operations, the ability that can come from bringing institutions in a local community together, I think just opens up new opportunities that otherwise wouldn't be there to help address both affordability and accessibility.
How has the rise of consumerism impacted the changing healthcare landscape?
Consumerism, I think, plays a part in it for sure, in the sense that accessibility and being able to meet people where they need and want their health care is an important element in today's world, whether that's in the real world, in the physical world, or in the virtual world. And by organizations coming together in a local community, they're able to think differently about how those physical services may be located in a more effective way to reach people that may not otherwise have access today, for example, to specialty services of one type or another. And certainly for those organizations that are developing the virtual capability to make healthcare more convenient, the ability to share that expertise with other organizations is one of the benefits of the kind of coming together that we see happening today.
How can mergers actually expand the scope of services that can be offered for a community?
The issue about expanding the scope of services for people in the community, I think, is at the heart of the reasons why organizations examine these kind of questions. I would also make the observation that in coming to these decisions, the boards of various organizations are looking very seriously at the question, how can we better serve the community? For organizations like my own, with the kind of specialty and deep subspecialty expertise that we have in my own organization, in the partnerships that we've developed with our system, we've been able to extend that specialty capability. And one of the primary tenets when we talk with potential partners is how can we help improve the availability of specialty expertise in your community? How can we keep as many people as possible close to home, close to their family, close to where they work and otherwise have their life, to be able to access specialty care that wouldn't otherwise be available?
But what about access? How can consolidation improve access?
So the access question can apply in a number of different areas. I just speak to some things that we've done ourselves. In the case of two organizations, we've been able to enhance the cardiac capability, the neuroscience, neurology capability in that community, helping an organization become a primary stroke center that had not been able to achieve that kind of status. Those are examples of real capability that allow patients to be cared for in their local communities in ways that they hadn't been before.
Tom, can you share some specific examples of clinical efficiencies that can allow for quality improvements?
One of the things I think about the development of networks and systems that's least understood, actually, is the ability to enhance the capability of an organization that becomes part of a larger organization that has this expertise. And in the area of quality and clinical efficiency, I think that's one of the areas where it becomes most visible. So in the case of an organization that became part of our system, prior to joining, they literally had no electronic health record, and frankly didn't have the resources to be able to do it. And so if they had not become part of our organization, they wouldn't be able to have that kind of platform that's just basic to providing high quality clinical care today. And that system is now in place, and we've combined that with the expertise in quality and clinical efficiency that our team at Cedars-Sinai has, and that's enabled that local organization to now be able to engage in the kind of disciplined process that is at the heart of being able to improve quality, improve safety, and improve efficiency.
Are there any cost savings that can come from this type of integration?
The opportunity for cost savings that comes from integration falls into several categories. The first is just the ability to spread the kind of administrative overhead that's required to operate a healthcare organization over a larger base, and in so doing lowers the unit costs for everybody who is a part of that system. One of the areas that is first addressed has to do with the supply chain and being able to examine not just the purchase price, but everything from the acquisition to the storage to the distribution, and to be able to take advantage of the economies of scale. In our own efforts to date in this regard, we have saved upwards of $15 million for the participating organizations just in that one area. Another is in areas related to the financial operations of the organization, things that many people may not think about but things like insurance, and being able to take advantage of lowering insurance costs, which for many organizations can be a significant part of their expenditures.
How can consolidation impact an organization's ability to branch into population health and other strategies for improving health?
So improving the health of a community is fundamental to the reasons why healthcare organizations are coming together. And that can play out really in two ways. One is with regard to population health management for patients that the organizations are increasingly becoming more and more at risk for delivering high quality and efficient care. That takes an infrastructure to be able to manage those patients and understand what their requirements are and how they can be cared for in the right setting at the right time in the right way. And the infrastructure to be able to manage that is something that costs money, and the ability to spread that over as many organizations as possible makes that all that much more efficient. Clinical efficiency is an important part of that. And so the ability to use electronic health records, clinical decision support systems, and other things like that empowers the physicians, nurses, and others in the care team in local hospitals to have the best opportunity to provide the best care for their patients. The companion is in community benefit, where organizations are looking to answer the question, how can we make services available to those who may not otherwise have them available, may not be able to afford care? But equally important are investments in how to keep people well, and investments, whether those are in social determinants of health, which are increasingly becoming understood in terms of the role they play, but also helping young people make wiser health choices in the food they eat and the activities that they're involved in.
Tom, in your opinion, what is missing in the public dialogue around why hospitals are merging?
I think there are several things that are missing from the public dialogue. Regrettably, the public dialogue has been dominated by various analyses that have been done looking from a distance at data sets and making certain assumptions, I think, about people's motivations and intent, and drawing conclusions from my observation are flawed studies. And what is missing is the ability to be able to, for the public to be able to see the real tangible impact in terms of helping to address the affordability question that has come about as a result of some of these organizations coming together. Part of that's a function of time. Americans aren't known for their patience. That's patience with a C. Americans aren't known for their patience, but the reality is achieving the kind of quality and clinical outcomes and efficiency and cost savings we're talking about ultimately comes down to culture change. And culture change does take some time. Now, we should be held accountable to move through that culture change as quickly as possible. But I do think that it's important for people to take the time to look behind some of the data and really understand the potential and the realities that have already been delivered. The other thing that I would say is missing actually is a lack of appreciation and understanding for how seriously the boards of these organizations take this question when they're looking at it. And so local community boards that may be the institution that's joining a larger organization take their obligation to do the best for their community very seriously. And I don't think there's been a good understanding of the thoroughness and thoughtfulness that has gone into these decisions, both by the hospitals that are becoming part of a larger organization and the thoughtfulness of the organization that entity is now going to become a part of, to answer the fundamental question, how does our coming together allow all of us to do more and better for our community than we do today?
What would you like policymakers to know or better understand about hospital consolidation?
I think taking two things. Number one is really understanding actually the role of the underlying drivers of cost and what role that has in the question of price. At the end of the day, any healthcare organization's price is a function of its cost. And when it comes to cost, there are two principal items. One are the input costs and how the economics of those input costs are driving up the operating cost of caring for patients. And the second is who they care for. Increasingly, as more and more patients are being cared for under an administered price system under Medicare and Medicaid, which have never really kept up with the underlying drivers of cost in healthcare, that ultimately does translate somewhat into the commercial prices. And understanding that dynamic is something that I think is vitally important as we go forward.
Tom, the hospital field indicates that consolidation leads to savings, but how does that lead to care becoming more affordable for patients?
With regard to the efforts and the successes that we've had with regard to making healthcare more affordable, number one, we need to do a better job of telling our story. I think that's something that all of us need to take ownership of and being able to communicate that to people in real ways. But there is the potential. Remember, at the end of the day, the savings that are generated by making our operations more efficient and becoming more clinically efficient ultimately only show up to the benefit of the patients if that's reflected in the commercial insurance premiums. And I think that may be one of the other elements that's missing in the public dialogue today, is the ability to really understand how the changes that are going on in the delivery of care and the cost of the delivery of care, and answering the question, are they showing up in the commercial insurance premiums that ultimately drive what privately insured people pay?
I imagine these cost savings help immensely.
The savings that are achieved by virtue of the development of systems allows the organization to fulfill its mission. First, every healthcare organization faces a significant capital challenge. One of the things that I think is not so well understood is just how capital intensive hospital operations are in order to keep compliant with either current regulations, new regulations, or just to keep the equipment up to date. And so the ability to make better use of their resources that ultimately just get reinvested into the organization and improve the ability of the organization to be able to provide better care, to be able to provide the equipment and capabilities for their staff to be able to take better care of the patients, to make the investment in information technology and other things that will allow us to, over time, continually make healthcare more efficient and affordable. That's all. That's all of those pieces of the answer to where's the money go, and how it's used, is another aspect, I think, of the story that we need to tell better as organizations.